got 30 people, right? Just about 30 people. Let's make it for the first, second, and third place. Each one of you guys get $200. Okay? Each one of you guys get $200 towards your next course. Let's make it big because we got a lot of people here today. So the first, second, and third. If you get fourth or fifth, work a little bit harder next week. Okay? You're very close. So now, how do points work? Let's say I got it right and you got it right. So the person that's faster gets a little bit more points. So not only you have to be right, but you have to be faster. And why is it important? You will get test fatigue. That's 175 questions, right? So it's the long question. So you have to really time yourself to answer the questions less than a minute, really a minute, 20 seconds. But we want to be having a little bit more time. So you see the questions and you answer the questions in Kahoot. All right. Go with your feelings. How many questions is in today? That's not that many questions. I had to delete some this morning. I believe it's about it's 44 slides. I have some answers, so it might be only 22 questions. And this today is about ethical principles, right? So we'll be reviewing a lot of the easy hanging fruit, but it can be also challenging because it's the things that we don't learn in school. It's the things that we don't talk about in school, right? Uh, so few things of the, or if we did, it was right in the first class, right? So we don't quite remember that much. So it's an easy hanging fruit. If you know it, you will get everything. If you don't, you miss them all because it's something that we don't learn in school. Okay, so not very long today, to the point, and we are about to get started. Is anyone, last call, is anyone having trouble still?
I'm
All
so
right.
sorry. I have one quick question. Forgive me. This is Kim.
Yes.
I'm
Hi.
seeing on my phone, you're in, see your nickname on screen. Like, do you see? Yes, I see it.
Okay.
So is this then going to go into where we can answer the questions? Is that
Yes.
the screen I should be on?
Yes. I
Okay.
believe so.
Thank you. I apologize for interrupting.
No
Thank
worries.
you so much.
Okay. All right. We're about to begin the game then. 1, 2, and 3. The game starts now. Answer correctly and answer fast. Sorry, the number is incorrect because I had to delete some questions.
I need $200.
We got 15 seconds. Pick your best answer. We have 26 answers. We got 10 seconds. Pick an answer, everyone. Touch your phone. Get an answer. 5 seconds and go. Okay. So let's see what is the confusion here. This is something you need to know. Absolutely need to know. Okay. So it is Mrs. Kim's R. She took the first place. She was so fast. Mary and Dard. Okay, Nikita, you got the fourth place there. So here we go, right? So level 1, right? You need to know your levels of evidence. If you don't, please review. You will get a question on this. Okay. So the hierarchies of evidence is the system used to rank the strength of the research evidence, right? So what is level ones, right? Level ones usually is called meta-analysis. Level 1 is systemic reviews, right? It's considered the highest level and typically includes meta-analysis and systemic reviews. What that is a group of randomized control trials. I put them all on the table, I put them in a system, I look each one of them systematically, and I come up with my own research article, right? It's a study that described the questions, describe in the question to one of the largest sample size, double-blinded, placebo-controlled trials, rigorous peer reviews. Okay, level 1 in summary, we have systemic review and we have meta-analysis. Either one of those are level 1. Okay, any questions on this before I move on? This is something important you need to know, super important. Okay, so everyone should really get this question right. If you didn't, do yourself a favor, go back and review level 1 and level 2. And also know that professional, the expert advice, cardiology, psychiatrist with 30 years of experience thinks we should go this way based on his experience is the least valid choice. Okay. Oh, but he has 30 years of experience. It doesn't matter. No one is better than the research, no matter how much experience you have, at least not for the board. Okay. So research dominates, personal experience is the least. So when we use personal experience, right, or case studies in some cases, which is better than personal experience, like COVID, we had nothing to go by. So we used a lot of case studies of this hospital trying something, the results, right? Okay, moving on. Next question. Good luck. We have 25 seconds. Okay, confusing this one, right? Let's take a look here of why this may be the best answer, but a very confusing question. Okay, so let's take a look here. So a level 2, high quality RTC, what that is, right? So obviously is below level 1. It's characterized by well-designed randomized controlled trials that have not yet been combined into a systemic review or meta-analysis. So it's one individual studies, right? So the starting question, which with its large sample, well-defined inclusion criteria and blinding, exemplifies a high quality RTC. Short studies are considered strong evidence because the randomized process minimizes the selection bias and so forth, right? While not at the level of the systemic review, the meta-analysis, a high quality RTC will still provide substantial evidence that can guide clinical decision making. This question was very difficult, okay? Very difficult the way it was worded. A very, very hard question because it wasn't really given to you the answer, but it kind of like went to say, hey, it looked at several studies, but it didn't say combine them. And that's the difference. So if you can look at several studies, you can look at 10 studies individually, right? That's RTC, that's like level 2. You get those 10 studies and combine into one, and you get one published size result. That's meta-analysis or systemic review. Extremely hard question. The way it was reworded, it was very confusing. So All right, we have 6 seconds. Pick your best answer and go. 3, 2, 1. Okay. All right. So we need to focus a little bit more on research, right? When we talk about research, we need to look at the quality and strength. That's very strong. Quality and strength of the research design and methodologies, right? Remember, sometimes I have to shorten the answer, which is not the case for this question, but because it's Kahoot. So the quality and strength of the research design and methodology is what we really want, right? What's the level of the evidence? So we want to get the research, get a Excel spreadsheet to put a level 1, level 2, and then later we select those research, right? Research refers to the quality and the strength of the research design and methodology used in the study. That's what we want. Define the research design often verifies the level of reliability and validity, which is why they are ranked in the hierarchy. Okay, so most of you guys got this one correct. Let's move on to the next answer. Do we have any questions before we move on? Okay, all right. All right, we have 10 seconds. Pick your best answer. I know it's fast, guys. All right, pick 5, 4, 3, 2, 1. Okay, okay. So if the question is about research, right, then the answer most likely is going to be related to research. So that's one of the techniques that we explain. Even if you do not know the answer, default to default to the techniques that we teach you in the strategies on module 6 as the first module. Let's say I had no idea about this question, but only one of the answers had research in it. I would have picked the answer, right? So the initial step in utilize evidence-based practice guidelines is to conduct a thorough literature research to identify relevant research articles and guidelines. As I mentioned, that's a lot stronger than a personal opinion, than looking at the chart or asking a colleague, right? That may be what we do in practice, but it's not the best answer related to a standardized test like the psychiatric nurse practitioner board certification. Research is very strong. Okay. Next question. So this should be a PMHNP test to develop a treatment plan for a patient with bipolar disorder who has experienced manic symptoms. Sorry about the misspelling there. PMHNP. Okay. We have 10 seconds. Pick your best answer. 5. Any answers at this point, guys? Pick an answer and go. All right. Well done, right? So EBP, evidence-based practice guideline, does not guarantee anything. Okay. In research, we say the research suggests. It does not guarantee. It's not a sure bullet 100%. It just suggests, it points, it supports. But anything that just says guarantee in research, that's like super wrong in research. You never say guarantee for research. You know, we gather the data, we saw what looks likely, it suggests, it strongly suggests, right? So for it to strongly suggest, it has to be a very strong evidence and analytic. We have to see the data and put it in the points in it, calculates everything, and spit it out the confidence level. If it's more than 95%, that's good. Less than that is not the best. 95% confidence is what we want. Okay? Never guarantees anything. All right. The questions about research. You do not know the answer. You are confused. What do? Go to strategy. Do we have an answer that covers research? 2 seconds and go. Okay. I see confusions between the blue and the green. Okay, I can see why a lot of people pick the green, right? Consult clinical guidelines from a reputable psychiatric source. So let's take a look here. Okay. Sometimes I cannot put an entire answer there. Here is what the rationale, right? Consulting the most recent clinical practice guideline published by a reputable psychiatric association best reflects the principles of evidence-based guideline. So let's take, for example, the VA clinical practice guideline. That's the one that I follow the most for PTSD. So instead of looking at meta-analysis, right? They already looked at the meta-analysis and they created their own clinical practice guidelines based on evidence, based on systemic review, based on um, practice and so forth on that population, right? So when I do have a questions, I go to the VA clinical practice guideline. Another one that I do it very, very often is the manic, the bipolar 1 and 2 Canadian guidelines because it really gets in details of every mood stabilizer and every antipsychotic. I highly, highly recommend for each case, maintenance, bipolar, and so forth. Right. So I really look at the guidelines almost like in a weekly basis, depending if I do have a question about putting. If you are in my class, you see that I do mood stabilizer and an SGA together, always for bipolar patient. I don't do just one, I do both because I want to cover the manic and the depressive episode. And I use the guidelines as my basis to prescribe. So these guidelines are typically developed through a rigorous process that includes a review of the latest research and expert consensus. They provide evidence-based recommendations for the treatment of specific conditions such as bipolar disorder and are regularly updated to reflect new evidence. By relying on these guidelines, the PMHNP ensure that the treatment plan is aligned with the current best practice, which can lead to a better patient outcome. Okay? So personal clinical evidence and intuitions are important, but should be supplemented by evidence-based guidelines to ensure that care is grounded in the most reliable and evidence-based practice. I Let's see here. What are your questions? Someone had a question on this specific topic. This one's a bit confusing as well, right? Because it's putting the clinical guidelines versus research. Okay. So someone raise your hand. I cannot see it. If you do and you want to unmute yourself, it's fine. If not, we'll continue. Okay. So it doesn't no one has question. Let's go move on to the next question. For seconds, pick any answer at this point. Okay. So most of you guys are getting. So we're gonna look at the reviews of multiple evidence-based guidelines from reputable source, right? Multiple, it was the keywords rather than say, hey, I came across the VA, I'm just going to use the VA, right? So the PMHNP reviews multiple evidence-based practice guidelines from reputable source. Keyword is multiple, and consider the recommendation, but ultimately makes the treatment decision based on their clinical judgment and experience. Now, from my clinical experience, I do see a lot of Asian population. Obviously, I'm located in an Asian country, and it is so true, right? I had yes, 2 days ago, I had someone that she's going through a major depressive disorder. She's really suffering. She's having a hard time at the work, and she talks to the family and say, "Look, these are the things that are happening to me." And the family just said, "You're lying. These things don't happen. You shouldn't say things like this." You know, so their culture, they keep it in. They keep it in, keep it in, keep it in. So it's very important to know how to open up, to have the patient, allow the patient to talk and ask the right questions so you can extract the right answer. Super good experience with the multi dynamic cultures, getting this feedback, how what we see in practice and what we see in research, how they actually eventually they'll come to meet each other. So all right, next question. So culturally sensitive care, we want the patient to follow the Western therapy. Okay, disregard disregard cultural norms, respect the patient's cultural norms, or refer the patient to a culturally similar mental health professional? Do we want to pass the bucket? All right, 2 seconds. Back any answer. All right, very proud of you guys. I tried to trick you, right? With the D answer that didn't work. Good job, everyone. All right, so that is the answer. Respect the patient's cultural norm, adapt to the therapeutic strategies to facilitate communications within the patient comfort level, right? So you don't have to pass the patient on to a Hispanic provider, to a Indian provider, whatever might be the case. If the person is comfortable with you, go with that. Try to understand what they're coming from and ask them, how does it mean? What does it mean to your culture, right? If in your culture you wake up at 2 in the morning, go for a run, which is, I'm making this up, right? If that's normal to you, then this is not insomnia, right? Now, if it's abnormal to your culture and you every night waking up at 2 in the morning and you can't go to sleep, you gotta find out the reasons why. Is it depression? Is it anxiety? Is it PTSD? Or is it adjustment disorder or many other things that could be, right? But always ask, look for the answer that says, how does it how does it relate to your culture? What does it mean? Explain a little bit more. How do you feel about this? Or educate me. That also can be an answer about your culture. Okay. So inquire the client's cultural backgrounds and believe to guide your approach, right? So this week I had a lot of good experiences. So I had someone that came to me. He's whatever. I'm not going to say all the details, but he came to me. He is gay. He's been depressed for 4 years. He's actually, well, let me take that out. I'm not going to go in detail. Uh, he's a very well educated, but he's been depressed the last 4 years. He's from India, and he was forced to marry a woman, and now he's going through the divorce, right? So he finally came out, and I had someone in the room. He asked the person to excuse and leave the room, and he finally opened up to me and said, "I'm gay, and I cannot let anyone know this ever. This is the first time I told anyone about it." And he was hallucinating as well, having well, he was having not hallucination. He was having voices of command telling him to hurt himself continuously for the last 2 months. This was a walk-in patient. So, uh, my point is, right, due to this very strange case, he didn't want anyone to know. He wasn't fully aware that his privacy is protected, but he didn't want his friends to know. He didn't want to be admitted because people would think where he would be. So what I had to do, I said, "Look, I'll drive you to the hospital myself instead of calling the ambulance." Right. So I drove him with somebody else on the car, and they drove him. So is it breaking protocol? Yes, it's breaking protocol because the protocol is to call the ambulance. But sometimes you have to do what's needed to accommodate for the situation. Point blank. Judge me later, that's fine. But if I have to break protocol for something that I think it's best for my patient, then I will do it. Fire me. Go ahead. So the point is, sometimes we have to do things for the specific situation. So culturally, it was very intense for him to say, "Look, I'm gay, and I can't have anybody knowing this. Otherwise, I'll kill myself." So I'm dealing with a very extreme situation of privacy. If anyone ever know this, he'll definitely do it, and I had no doubts about that. So in that case, I prefer to break the protocol, not call the ambulance, take him with me in my car to the hospital, deliver, give a specific instruction to the receiving doctor in the ER, make sure his privacy is protected, make sure that his escort is out of the room when you speaking to the patient, and make sure that when he goes to the our unit, it goes directly in. Only people that needs to know his situation needs to be aware of. Do not leak any of these personal concerns to anybody else that does not need to know, because this is a timing bomb waiting to happen. For him, it's very real. The pain is very real. So it's very important. I think it's the highest level of importance, and we respect the patient's privacy, because we don't want to have this in our conscience that we talked about someone, we did something to someone, and someone, how the person took, we don't have no control of it. We have controls of what we say and how we feel about it, right? All right, next question. So the bottom line here is you advocating. How do you provide the most impact when you are advocating? Think about the lectures that we had about this subject. All right, we have 8 seconds. Okay. So I just want to kind of remind you a little bit more through so I couldn't put all this answer in there, right? So I had to kind of shorten the answer that describe the correct answer. So anytime you hear us advocating for the patient, right? Think about restrictive care, but think also about median. Think about delivering your message to the most amount of folks. How do you advocate for in mental health? Is by decreasing the stigma. Anytime you hear stigma and advocating together, they go pretty much hand to hand. Okay. Not very specific to this question, but I want to keep this point in mind because you are testing soon. All right, we have 15 seconds. Pick an answer, otherwise you may not have a chance. 10 seconds left. 2 seconds left and go. Okay. All right. How is the blue answer better than the yellow answer? So identifying policies, issues, conducting research, and evidence-based practice recommendations. Super strong answer, right? Let's look at the orange. Focus on the individual patient care and continuing education, right? So pretty vague, but this is about research, right? So you pick an answer that's research related, right? When engaging healthcare policy advocating, key components includes identifying relevant policies issues, conducting research to understand the problem and potential solutions, developing evidence-based recommendation policy for changes, right? Includes advocating for mental health stigma reduction. This approach ensures that advocacies are grounded in the thorough understanding of the issues and are supported by solid evidence, right? Remember, advocating, what goes together with the advocating as well, right? Can be a trick question here, though. Okay. Remember, I actually guide you wrong here on this question, didn't I? Right. So the orange it was a super strong answer. Okay. Formulating, implementing regulations to improve access to mental health. I couldn't put it a very complete answer, right? But anytime you hear really stigma, decreasing the stigma and advocating, that goes together. Now, formulating and implementing regulations to improve access to care or improve access to mental health illness is also as important as decrease of mental health stigma. Okay, sorry, I kind of guide you wrong. I gave you a very solid statement that may have confused you guys a bit more. So, one essential component of health policy is the formulation. So, he is talking about health policy, not as much as advocating. So, health policy is the formulation, implementation of regulations that aims to improve access to mental health service. So, that was the difference. Health policies involve creating guidelines, laws, regulations that shape the delivery of healthcare service, including mental health care. Okay. So difference between advocacy, stigma reduction versus healthcare policy, the formulation and implementations of regulations to improve access to mental health. Okay. Keep those two subtopics. They're close related, but it's slightly different the answers. If you're asking for advocacy, it's going towards stigma reduction. If you're asking about policy formulation, it's going towards making access to mental health care available. So policy making to bring about meaningful change. Now, engaging policy making related to mental health. How do we do it? how are we most strong, most powerful as a group or individual? Wow. Wow, that's super, super duper. Okay. So you guys actually did a very good job. I thought the right answer was super enticing and it would get a lot of people confused because if you submit into the local news, you're spreading the news to many, but you guys are too smart. You realize that together as a group, you are forming a coalition, a group of strong healthcare providers and stakeholders. And that is the right answer. Very good, guys. So here is the answer: forming a coalition with other healthcare providers, advocating groups, and stakeholders who share similar policies, right? If you are part of ANA, you are much stronger in that way because they can lobby for you, for your rights, for your profession, rather than you going to the median alone and stating your case, why this or that should change. All right, we have 10 seconds. Pick your best answer. Okay, all right. So, advocating for policy changes based on personal beliefs and clinical experience, right? So, that is same thing as saying out of the research, we are picking personal experience or the expertise of one person rather than the research. What would be like looking at the research, comparing, obviously, it's not the same thing, is we collaborating with healthcare professionals, organizations, and policymakers in order to make a change, right? Remember, alone, we are very weak. Together, we are much, much stronger. So the collaboration with the other healthcare professionals, organizations, and policymakers to gather data, conduct research, and build a strong evidence care for policy change. Remember, I cannot put all this into the answers, but here I'm able to give you a little bit more of the right answer, right? So why do we do this? Because collaborating makes it as stronger. It builds a strong evidence-based case for policy change is the most appropriate and effective evidence or approach. Okay. Next question. Initial action, right? Okay. So collaborating, right? So collaborating on both sides to find a balanced approach that address the need of expanded coverage and considering cost containment measures. So uh kind of like very, very vague answer, right, to this question. So but most of you guys got it correct. Very vague. So we're looking for potential barriers and facilitators to its successful implementation. All right, we have 15 seconds. Okay. All right. So collecting frequency and the type of medication errors in the psychiatric department. So when you're collecting, that's not a action, right? That is an assessment. You're collecting the data to assess the problem versus assess the learning needs of the staff nurse. So even before you assess the learning needs, you need to get the frequency and the types of medication error that are happening. Okay. So collect the data and the frequency and types of medication errors to have that have occurred in the psychiatric unit over the past year. So you need to see what's the problem before you even address the staff needs. Okay?
This one stumps me pretty bad because one
Yeah,
was the word assess. And I knew we wanted to assess first and collecting data
absolutely.
as an assessment. But if you don't know that your staff doesn't know how to give the meds properly or something, that seems like the beginning.
Correct. But if how would you say there is a problem if you haven't assessed the frequency and the type of medication? Right? So
Can
it's kind of like going back to like, okay, let's talk about a problem that we are having, but I don't know what's the problem is. So the
can we look
initial
at the
act,
question again?
I can't go back. I can't go back to the
Okay.
question. But this one was tricky because absolutely exactly what she said. But if you look at the rationale for assessing, when you are collecting data, you are assessing. When you're looking at the labs, you are assessing. Assessment for us as we move on to a prescriber is not so much doing physical assessment, the things that we think it is. It can be an implementation, an action, as in I'm looking at several research to find out what would be the best answer. So that's an assessment. It's not an action of implementing, right? Taking the vitals, that's an assessment. Compared to RN, taking the vitals would be an implementation. Okay. So the initial action is developing policy to address the medication's error that should be collected on the frequency types of errors that have occurred. That is essential for understanding the scope and specific of the problem, which will inform the development of the target intervention after that, right?
Okay, I think I presumed that.
Oh, I'm sorry, I couldn't stop, but uh, we can talk about this one again in a little bit. Okay, so this one was a bit more clear, right? Still, the green was enticing. Okay, but you want to collect the assessment to identify. Collect the assessment to identify whatever the problem is, right? So much like the previous questions, you need to identify first, right? But this one was a little bit more clear. Still, it was difficult. The green answer was enticing. So collecting the data on the frequency and the type. Well, this one's actually that the answer doesn't quite match, but you that is the correct answer. So you want to assess of what is causing the problem before even you conduct an intervention. Let me open the door for my dog. All right. All right. This one's okay. How can I rephrase this question here? Okay. This one was a super, I would say, a bad question, right? Because the intent here was, my intent was to say, how do you send your message to the most people so that the errors can be prevented? I put a bad question. Okay. So this question would have been more like the answer have been collaborating with the local media's outlets to share personal stories on individuals who have overcome mental health challenge. So I got you completely wrong on this question. So I do apologize, and I can see why the red answer there was a better answer for the question that I put out. Okay. So my apologies on this question, but nevertheless, the point is, if you want to, the point that it's trying to convene here, it was, if you want to spread mental health stigma, to prevent mental health stigma, how would you do that? Right? The point is, if you want to pass it on a message about an error that has happened, and you want to create awareness, that's the better word. If you want to create awareness of any issues on mental health, you do it through the media rather than doing it through the classroom. Here, a perfect example that gets a lot of people wrong. Let's say a high school had a suicide event. Okay. Now, that's one part of the question. The second part of the question is, how can you spread the suicide how can you spread suicide prevention through the community? Guys, don't fall for this. This is very, very classic. So I'm feeding you a beginning of the question, making you think this is about the high school, and then I switch to the community. Option A: teach suicide prevention at the high school level. Option B: spread resilience through the social media for community support, right? Option A is very specific to the case of suicide in the high school. But do you see how I switch the question at the end? So pay attention on the change of what begins, but what is the question actually asking you? It's asking about the community, not necessarily about the event on the high school. This type of questions is not so much knowledge, right? It's a test taking strategy that you need to know. Because we do this because we know that people is going to answer according to what they first read, which is the high school suicide rate or event. Okay. So let this question, it was a bad question to serve as an example of how a question can be switched within the same question. So read the question before you ever answer. Ask yourself, what is the core of the question? What is it really asking me? Any questions about this example that I gave? That's a very classic example that shows up in tests all the time. Okay. All right. Few more questions to go. So here is about just culture, right? So the core of the question is about just culture. What do you remember about just culture and prevent future errors? We have a specific topic called just culture. What do we do? What does it mean to you? All right. So just culture, when we speak about just culture, it's not about reprimanding. It is not about the individual. It's about getting the system correct. But, 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 specifically on just culture, it says that if it's reckless behaviors, then we need to address that with the nurse. So, what is reckless behaviors? Not following policy is a reckless behavior, right? Depending of the circumstance. Sometimes we may choose not to follow the policy, but we have to have a strong rationale for why not following the policy, or at least something that can be like, okay, I got it this time, right? But not following policy, it is a problem, right? Specifically if it's a repeated behavior. But in summary, just culture means doing what's right for the patient, addressing the error and not addressing the person. It's addressing the system, not the person specifically. Okay. However, if it's a reckless behaviors, it's a showing patterns, we may have to address the individual. So here is about implementing quality improvement. So how do you do quality improvement? Well, you guys are fast. Look at that, 19 seconds left. This one might get some of you guys because of the name here is associated with something else. So let's see. Okay, they didn't get as many. So when I hear root cause analysis as a nurse, as a flawed nurse, I think, well, something went really, really wrong, right? Yes, but it may not be it. I want you to look at the root cause analysis as a performance improvement. So write it down. Root cause analysis can be a performance improvement. In fact, on the test, it will look like a performance improvement, not much as someone died or someone had a rib fracture due to a fall, right? That would be a root cause analysis for sure. But on the test, root cause analysis has to do with performance improvement, okay? Which is very different from us that have been involved in root cause analysis before as a nurse, and that can be tricky, right? So conduct the root cause analysis to identify the factors that contributed to the error and implement corrective actions to, to prevent similar incidents in the future. So root cause analysis, delayed in the ER of patients coming to the floor. How is that root cause analysis? So we're trying to identify the factors that contributed to the problem. In this case, delayed patients coming from the ED to the psychiatric unit. Classic example. Doesn't look like a root cause analysis, and that's why it gets a lot of people, right? So that is, you have to identify the problem. That is root cause analysis. Very different than what we know as a nurse on the floor. Quality improvements in assessment and documentation process. So it's a quality improvement project. We want to review the patient's chart. We want to focus on quantitative data. We want to gather a multidisciplinary team to assess. Do we want to share the improvements, plan stuff, and expect immediate adherence, right? So again, kind of tricky, right? A sounds really good, but we just said that's a quality improvement. Okay, quality improvement. So let's take a look here. So gather a multidisciplinary team to assess the current state of care, identify the root cause of the issues, and develop a comprehensive improvement plan. So that would have been the entire answer, but I have to shorten. So that would have changed your answer. Remember, Kahoot does not allow me to put a full answer. I have to shrink it. So in quality improvement initiative, involve a multidisciplinary team, ensure a comprehensive assessment of the current state of care that helps identify the root cause of the issue, right? From a multiple perspective. So that would have been a very strong answer. Maybe you didn't have all you needed to pick this answer because Kahoot does not allow me to put as many words in it, right? So conduct a one-time review. They may provide initial insight, but it's likely lead to doesn't lead to a substantial improvement. And the other answer, I don't remember what it was. I would have to go back, but it wasn't as strong as the root cause analysis. Okay? All right. Again, this is about quality improvement. All right, we have 15 seconds. Pick your best answer. All right, 2 seconds and go. All right, so this one was a bit easier. So you want to consult with the clinical staff together, input, identify areas of improvement. So we want to do quality improvement. We want to identify areas of improvements, and that is do a root cause analysis, gathering the charts, collecting the information, and involve a team specifically if possible. If you see collaboration, that is a strong answer as well, right? So to implement changes. Next question. Well, we do not have a next question. So today was ethical legal principle. So Trace, well done. Kim R, super well done. And first place today was H HJ. I don't know who you are. We got Janet fourth, and fifth was Ramina. I am sorry, I can't pronounce your name, but you guys all did a fantastic job. I know this is hard. There was a lot of people today, 30 people. It's a lot, but you guys are killing it. The rationales, it was difficult today. It was some of the questions could be better. So I will work on that, make it a little bit more clear. But the fact is that the board sometimes will be unclear. So being comfortable with questions that you don't know the answer, or you could go A or B, and defaulting to your basics strategy is important. So this is pretty much ends today's event. Let me take a picture of this screen here, and then we'll go back and deal with few questions that you may have, a few things that I can help you for the task, for those that are testing soon, right? Will be basic discussion about the program, how you can join. But as far as questions and very tailored specific teaching, this is it for today's event. Now I'll focus on individuals questions and things that